package, sterile tray containing vaginal speculum, vulsilum, uterine sound, sponge holding forceps, then bowel containing cotton swab, sterile gloves, scissors, disinfectant solution, kidney tray. Procedure of copper T insertion, patient preparation. Explain procedure including advantage and disadvantages, risk and benefit of copper T. Instruct women to empty the bladder. Provide privacy and wrap with a sheet covering abdomen and legs, leaving perineal area exposed. Position woman in a dorsal recumbent position. Position her on back, hips and knees flexed and thigh abducted. Instruct the patient about how to locate the copper T threads and verify the position of copper T after each menstruation. Insertion of copper T, preparation of articles, equipments assembled before procedure, inspect external genital, urethra, vagina for the sign of infection, lesion or discharge. By manual examination, through the sterile gloves determine the position of uterus, keeping speculum in the vagina to you visualize the cervix. If cervix bleed easily on touch or plurulent vaginal discharge is seen or any abnormal sign found, the copper T should not insert it. Then clean the perineum. Explain women that there will be slight discomfort during speculum insertion. Insert the speculum gently and observe the cervix for the sign of infection or erosion. Clean the external cervical OS with an antiseptic soaked swab by using sponge holding forceps. Instruct the patient that there will be discomfort, pinching pain when applying the vulsilum. Apply the vulsilum at 12 o'clock position on the cervix, grabs the lip of cervix, then pass the uterine sound into cervical canal and insert carefully into the uterine cavity while pulling steady downward and outward on the vulsilum. A slight resistance indicates that the top of the uterine sound has reached the fundus and remove the uterine sound. Measure the length of the device to be inserted into the uterine cavity. The depth of gauze on the inserted tube is used to mark the depth of uterus. Pull the loaded inserted tube gently until the distance between the top of the folded T and edge of the depth gauze closest to the T is equal to the depth of the uterus as measured on uterine sound. Carefully peel the clean plastic cover of the package away from the white packing. Lift the loaded inserted, keeping it horizontal so that neither T nor white rod falls down. Be careful not to push the rod towards the T. Grabs the vulsilum and pull firmly downward and to align the uterine cavity and cervical canal with the vaginal canal. Gently introduce the loader inserted assembly through the cervical canal, keeping the depth gauze into horizontal position. According to the position and the direction of the uterine cavity, gently, carefully advance the loaded insert assembly until the depth gauze come in contact with the cervix or resistance of uterine fundus is felt. Hold the vulsilum and wrap gently and slowly withdraw the inserted, keeping the plunger in place. Check for the string protruding from the uterus. Cut the strings shorter so they protrude only 3 cm outside the cervix. Remove the vulsilum. If there is excessive bleeding from the vulsilum site, press the sterile cotton ball to the site using forceps until the bleeding stops. Remove speculum and wrap Instruct patient to stay in bed for some time. Wash perineum with soap and water and dry it. Remove gloves and discard. Instruct the woman on follow-up measures to confirm presence of copper T timely by feeling the presence of thread in vagina. Instruct patient to visit clinic whenever she experiences the warning signs of problem related to copper T such as pains, P were delayed periods, spotting, bleeding or missed period. A abnormal pain or pain during coitus. I infection, any vaginal discharge, and for not feeling well, fever, vaginal or pelvic pain. S string, not feeling the string in the vagina. So to expect during an IUD removal, it's look IUD strings and then gently grabs with the forceps and slowly pull on them. IUD slide through opening of the cervix. Complication, early complication, vasovaginal attack for fainting, spasmodic pain, uterine perforation, late complication, excessive vaginal discharge or leukorrhea, lower abdominal pain, dysmenorrhea, menstrual dysfunction, pelvic inflammatory disease. So demonstration I will make on the another video. So please like and subscribe the channel. Thanks for watching.